all, let me clarify, I am not an entrepreneur. I work for let me do my introduction first before I start the speech to clarify. I am not an entrepreneur, I work for a trade consultancy. Second thing you said, miracle myeloma, it is multiple myeloma. So let's start the speech. If I were to tell you that Lisa Ray and my father had something in common, you would think it's weird. What can be common between a beautiful model and actress and my 72-year-old dad? But they do have something in common. They both have multiple myeloma. Good evening, Toastmasters and guests.
Good evening.
Today I'm going to talk about multiple myeloma. This disease, as well, is a rare form of cancer, and according to the Patient Education Institute report, some 50,000 people in US find out every year that they have multiple myeloma. Multiple myeloma, and the key thing is this is not contagious, and it's prevalent mostly in people aged 50 to 70 years, though there are cases of much younger people being affected. This is a cancer of white blood cells, which are very important for our immune system. Basically, all white blood cells in our body, they are formed in the bone marrow, this soft spongy tissue that's there within the bones. During the formation, there is some differentiation in the sense that some of the white blood cells move out of the bone marrow and go into other cells, other systems, and develop. Whereas the ones who remain so, they are referred to as the plasma cells. They remain within the bone marrow and they help the body's immune system to fight against diseases and infections. Now the ones that remain, the plasma cells, they produce antibodies, which are the ones which help us fight infections. Now when cancer affects a plasma cell, it starts dividing uncontrollably. As a result, you have more cells of the same kind. You have unneeded plasma cells now, and these are abnormal and they are identical and they cause a lot of problems. These unwanted cells are called myeloma cells. Now these myeloma cells tend to, in most cases, they tend to collect in many different bones and cause tumors and other problems. When this happens, it is referred to as multiple myeloma in many locations. As in a normal case, a body will have different plasma cells producing different antibodies which can help us against different diseases. But in patients who have multiple myeloma, you will, because of the excessive presence of one kind of plasma cells, they will have excess of one kind of antibody. Now, what are the symptoms of this disease? If you look at the patients, you find that because of this aggregation of these myeloma cells in the bone marrow, you find, and forming tumors, most of them suffer from a lot of bone pain. Some of them even have extreme cases of having bone fracture. Okay, that is that's why people with this disease have difficulty even moving around. At one point, I remember my dad was bedridden; he could not move around because of this. Second symptom I would say is that you see that happens is these patients, because of the bones being degenerated, a lot of calcium, excessive calcium is released into the bloodstream. So that again leads to a situation, a scientific condition called hypercalcemia. Okay, this again has its own problems. The third thing that happens is because of the presence of these cancerous myeloma cells, they have an impact on the production of normal plasma cells and other white blood cells. So therefore the immunity of the person decreases significantly, and the person easily catches infections that would for us be very normal to fight. Okay? So even the very simple infections by which we would normally get over through our immune system, they would not be able to fight. So that is the third symptom, very important. And the last one is people with this kind of disease, their kidneys are affected. The reason being excessive secretion of excessive antibodies and these calcium. So the kidney finds it difficult to filter the blood. So these are the key symptoms. Now how do you diagnose this? There are blood tests, there are X-rays of the bone, bone density tests. In some cases they actually take samples from the bone marrow. It's a little painful. They take samples from the bone marrow itself to test if it's cancerous and what's the level of it. Now what is the treatment for this? There is no known cure for multiple myeloma. Whatever happens in form of treatment is just improving the quality of life by eliminating physical pain and maybe bringing down some complications. But there is no cure. The main treatment is in the form of chemotherapy and radiation therapy, but this cannot limit itself only to the cancer cells, and even the healthy cells of the patients are affected. Therefore, there is a lot of side effects having this treatments. In addition to the main treatment, most patients have to undergo other treatments like medication, antibiotics for infections, medications to control the calcium levels of the blood, operations for bone fractures, and of course dialysis for clearing the blood. One of the latest techniques available in this treatment is the stem cell transplantation. Stem cells technically are the basic cells, basic unit of a bone marrow tissue, and it is from these cells that the blood, all the blood cells are produced, all the different types. So basically in this treatment, generally taken in case of advanced stages, you actually remove the entire tissue using high radiation and drugs and replace it with healthy cells. And but this stem cell replacement also is not permanent. It has to be repeated periodically. This model, Lisa Ray, actually successfully underwent this stem cell research, stem cell transplantation, and she is doing fine now. But there have been future, like last year, they had some pioneering research in the field of genetics, where they actually studied the genetic makeup of the myeloma cells in the US, some cancer institutes in the US, where they have made the comparative study of a patient's normal cells and these myeloma cells, and have detected some pathways or some proteins which actually help trigger this cancer. So maybe in the future we may have something of a gene therapy where you can target only the cancerous cells and maybe avoid the side effects of infecting healthy cells in patients. But as far as the best treatment is concerned, I would say is for the patient to actually do something about his or her sickness. In case of Lisa, she ran a media campaign in Canada in association with an organization called Myeloma Canada, and creating awareness. The campaign was titled "Make Myeloma Matter," and the aim was to create awareness about the disease and to help people get access to the right kind of treatment at the right time. My own father is an inspiration because every time he goes to for his chemotherapy in Dubai Cancer Institute, he makes sure he speaks with at least 3 patients and shares his story of his battle of 11 years against this disease, and shares his faith and encourages people who perhaps have no encouragement. to conclude by saying that, by quoting John Maxwell, life is 10% of what happens to me and 90% of how I react to it. So the best thing a patient can do is to reach out to other patients and make his own mess or her mess their message. Over to you.